Yes, ma'am. Yes.
Can I say something, Alana?
Yes.
There is one other thing here, of course, which is that Alana and I went there on a very short-term contract and felt obliged to speak out, despite a contract gagging us essentially from doing so. And we decided to speak out because that was all we had to offer the families that we met on Nauru. They were desperate, absolutely desperate. They'd been there over a year, had no idea what was happening to them except they were never coming to Australia. And so we felt obliged to speak out on their behalf, to advocate for them. The nurses and medical staff working for IHMS are on contract, and if they speak out, their contract's not renewed. So for Alana and I, there's less of a cost in terms of speaking out. IHMS were very angry with us, but we said, well, we felt we needed to speak out. They said, we feel like changing things from within. We said, well, the Red Cross wants to act like that and change things from within without complaining about the politics. And Médecins Sans Frontières broke away from the Red Cross because they said, we can't do that, and we will only give care, medical care, if we're allowed to comment on the politics. And we feel like Médecins Sans Frontières in this, and you're like the Red Cross, except the Red Cross doesn't get paid for doing it, whereas IHMS has a very healthy contract and so is quite conflicted.
Is it your experience, I'll ask either of this, that it was locals or expats, staff who perpetuated the verbal and physical abuse of detainees that you observed?
So the physical abuse that I observed was a guard that had pushed a father of a baby that David was treating. So we were inside the medical centre, and inside the medical centre there is an emergency room, a long corridor with eight or so consultation rooms running down it, and a waiting room at the other end. So I came out of one of the consultation rooms and went up to the emergency room to get the father. I asked the dad to come with me, and the guard pushed him in the back and said, I told you to get down there. It sounded like, but don't quote me because I never asked the guard where she was from, but it sounded like the guard was from New Zealand. She had a Kiwi accent, but as I said, I never asked her country of origin.
Was there an attitude that you've observed that people deserve to be treated that way?
Can I give you an example then, Senator, if I may, of just that? So I was seeing a child who was quite a disturbed little boy, and I became aware that the mother wanted to talk. So I sent the little boy outside with Alana, and then I talked to the mother through an Iranian interpreter. And the mother confided in me that she'd been raped. And I won't go into the full details of that, but she wept for 10 minutes and told me that even since the rape, she'd been propositioned on a couple of times by guards, one local guard, one overseas guard, and they had propositioned her and said they would let her have longer in the shower, because you only get 2 minutes shower a day, but that she could have longer in the shower if she showed them her breasts. And after she'd told me about this, I asked her if she'd told anyone about it. She said, I don't want my husband to know, but I've been in touch with Senator Hanson-Young about it. So I talked to the senior medical staff, and they said, well, we've got an Iranian psychologist, a lady. And I said, that would be perfect. She needs to see this mum. This mum needs to see her urgently. So the Iranian psychologist, who's employed by IHMS, saw the mother, and then she reported back to us what she had found. And she said, well, the woman was wearing very provocative clothes, and Her manner is quite provocative, and I asked her when the man raped her why she didn't cry out. And I had to stop her at that point, and I said, if I had spoken like that about a woman and implied that she was asking to be raped, you would have been understandably outraged. How can you speak like that? So that's one of the staff meant to be helping the families and acting as if they deserve rape when they get raped. And so I'm not saying that was necessarily widespread, but both Alana and I felt that the staff at times acted as if the detainees deserved to be treated with less respect than they would of someone from their own country.
When David did a lecture when we were there, he gave a lecture on compassion, and about 3/4 of the way through the lecture, the senior nurse that was working for IHMS got up and called all the other nurses out of the lecture. And when David asked her why the following day, she said that she found the lecture offensive. She said she found the lecture offensive because she felt that David was being, or presuming that none of them treated the asylum seekers very well.
Okay.
Really, this was the same nurse that called the boat number and said that there were too many Mohammeds. So it was almost as if she was being defensive, really, about her own behaviour.
Okay, we'll go to Senator Reynolds and then finish with Senator Hanson-Young. And we have about 8 minutes if we're to hopefully stay half an hour behind schedule.
That's right. My questions will be very quick, and thank you very much. And thank you very much to you both for your testimony here today. I just wanted to clarify a couple of bits of information. So you were both contracted by IHMS, correct, to do an assessment and report for them?
Yes.
Correct.
And
Okay.
to see children in consultation, Senator. Yeah.
Okay, so to do that, you did a 5-day visit once to Nauru, correct?
Correct.
That's correct.
So that was fact-finding and doing some lectures and, you know, the other activities there.
The main aim was to see children in consultation. So we saw 30 children in 5 days and quite complex behaviour problems and so on.
So how long
But they were picked for us, Senator, by IHMS.
Okay.
We weren't allowed to choose the children that we felt may need to be seen.
But they initiated this. So they initiated this assessment by you.
Yes, they asked us to go there.
Okay, so they asked you to go and do this. So you did some lectures and some other things while you were there, and you interviewed 30 children over 5 days. How long did you
Yes.
spend with each child?
At least an hour with
At
every
least.
child. And we also did some consultations down at the Republic of Nauru Hospital, which is outside the processing centre, the regional processing centre.
So you talked to that. Were they children as well, or were they adults?
We talked to, I'm a pediatrician, so this was all children, but of course children are often too young, so the adults give the history, and there's always an interpreter. We always had to have an interpreter.
That's going to be my next question is, so for these 30 plus interviews with children, so they had their family member there and an interpreter as well?
Exactly, and the interpreters are excellent. They're
Okay.
really very good.
Okay, so you're employed by IHMS to do this report. Now, you said you provided this report to IHMS, and then that I think you said that they had implemented, because obviously you're just there for that particular contract, and then you left IHMS's employ?
Yes, and I mean, they would have invited us back if we hadn't gone and blown the whistle, yeah.
Well,
Can I just
breach,
say
maybe
one
another way to
thing?
put it is breach of contract as well, because presumably in your contract to do this report, as part of doing this report for them, which they initiated, there would have been a confidentiality clause in there.
There was a very strict confidentiality clause.
But you
Yeah.
accepted that, so you accepted this contract to do this piece of work at their initiative.
Yes,
Okay, so you're saying that they then initiate, so in terms of the recommendations you made, you said that they implemented your recommendations? Or,
No.
Some of them.
Okay. Do you know which
one of
ones
them.
they did implement?
When we were there, we were asked to go to the Republic of Nauru Hospital one afternoon. We had children booked in to see us in the processing centre at 1:00. We didn't get back until very late that afternoon, and the children were waiting in the waiting room until 7:00 that evening. I asked
How is this
for
relevant?
meals to be taken or to be got from the
sorry,
mess.
Ms Maycock, I
to
think you may
feed
have
the
misunderstood.
children.
I think you may have misunderstood my question. My question was, of the recommendations in your report to IHMS,
Just food.
you said
Just
that
food.
the recommendations had been implemented.
Just one of them.
Okay, one of them had. How do you, now that's when you left, but have you got any way of knowing which other ones have not been implemented?
They told us when we had a meeting with them when we returned that they couldn't implement our recommendations because we weren't seen as credible anymore because we had gone to the media with our information.
So you went to the media before they'd had an opportunity to implement your recommendations that they asked you to do?
No.
No. So we were there to see...
So I'm just trying to understand the timeline here is you're
Okay.
engaged by IHMS to do this inquiry. You went and did it.
We're engaged by IHMS to see children in consultation, sick children. That's what we were there for. At the end, they asked us to write a report on our visit,
Yes.
and we wrote a number of recommendations to them, and we delivered that to them, but at the same time we went to the media. So then we had already arranged a meeting with IHMS, and they said, we wish you hadn't gone to the media. I don't believe that we broke our contract because you're in fact allowed to approach the media about iniquity, to reveal iniquity.
But I guess
And
the
what
key-
we saw was iniquity.
My question relates though to that you were paid, which you did. You went and did a confidential report for IHMS because they clearly wanted to understand, whatever it is they asked you to report on. But at the same time as you gave them the report, you went public, which then made it very difficult for the organisation who'd contracted you to do this inquiry. So basically they had no opportunity to implement the recommendations.
Okay, Senator, 3 months before we went there, Hasantha Gunasekara, the other doctor, went to the centre and made recommendations. We had a copy of his recommendations, and when we went there, they hadn't been implemented. When we returned, we sent them a copy of the recommendations as well, saying, Dr. Gunasekara made this recommendation, why hasn't it been implemented? Dr. Gunasekara made this implementation, why hasn't it been recommendation, why hasn't it been implemented? So many of the recommendations that we had made had also been made by Dr. Gunasekara.
But the other thing is our recommendations are to improve the health of children. They're not about IHMS specifically.
But the thing is though, you were paid, this is what I'm trying to get down to the point, is regardless of what was in there, you were paid by IHMS to deliver a contracted service, which you did, but at the same time you released this paper you were paid to deliver before they had an opportunity to consider and implement the recommendations.
No, we didn't release the paper. We went to the press and did an interview.
Well, I've got
and
to,
wrote an article in
with
which
respect, if you go to the press and talk about it, I think there's not much greater publicity.
Can Senator Reynolds stop berating the witness, please?
Well,
Perhaps we just have some order for a second. Now, I heard the evidence was that you went there to deliver services as a paediatrician to children. That was
Correct.
That was what you went. In the course
Yeah.
of that treatment of children, you made some recommendations.
Correct.
So the contract was to treat children in detention.
Primarily to treat children, and we did that.
Okay.
I thought you said it was to assess the children and write a report.
No. The report was, they asked us for a report at the end, but the main reason for going was to consult on children, to do consultations of children. And I was actually paid, we gave the money to the refugee clinic at the Children's Hospital because we didn't want to profit from it at all, but we were paid a per capita fee for each child we saw. That's what the contract was for.
Just my final question, given the time, is have you read the Moss Review report?
Yes, I have.
Okay, and are you supportive of their recommendations?
Yes, I would be supportive of their recommendations. We were not allowed to talk about child protection issues while we were on Nauru because the Moss report was underway.
Okay, so you're aware at the time the Moss Review was underway. So when you released this material to the media, did you consider also making a submission, or alternatively putting those recommendations or your concerns to the Moss Review directly, given they were in location at the time?
The Moss report was about child protection issues, and we went to see and asked, are there any child protection issues? And they said, we don't want to talk to you about that because the Moss Review is underway and we've been told not to talk to anyone.
But if you had concerns, but my question is not on anybody else's submission, but given you felt so compelled to release your report or some of the findings to the media, and you knew the Moss Review was underway, was there ever any thought that it would be appropriate for the Moss Review to consider your concerns rather than going straight or just to the media?
We talked to Gillian Triggs and the Australian Human Rights Commission about their report on the forgotten children. So we gave evidence to them, but the Moss Review was dealing specifically with child protection issues, physical and sexual assault of children. And we didn't witness that while we were there, and we didn't have any reports of that. So I had no reason to go to the Moss report.
Okay, at that point, if we need any clarification, are you available at a later date if we have another hearing to have any clarification?
Absolutely.
Okay.
Absolutely. We think this is very important.
Okay.
Congratulate you on your Senate inquiry.
In those terms, thank you very much for the evidence that you've given to date, and you remain available to be called back at a later date. If there are any questions on notice that you've taken, the committee has set the 15th of June for the answer of those. So thank you again for your appearance.
Thank you for having us.
Thank you. Yeah. Thank you for listening to us.
We're now